question for pediatrics, that's children medicine. Now for the next question for pediatrics, they said that a patient presented with neonatal jaundice. Of course, we are talking about a kid. So you should list the possible causes of the neonatal jaundice and also the radiological investigations for neonatal jaundice. So for the causes of jaundice, is not haphazard. Okay, you have to classify it. Okay, so I think from my student point of view, let me just talk about what I can remember about it. Causes of jaundice, you have causes because maybe the bile tract was blocked. You have causes because the bile did not conjugate. Okay, then which causes again? You have causes because of red blood cell breakdown is too much, producing too much bilirubin. Okay, so let's go in. Now for the causes now, we said that jaundice in children just have to do with elevated bilirubin. Okay, and several reasons. Okay, so you have the pre-hepatic causes. Now pre-hepatic causes, that's where you say the issue is happening before the liver. Okay, pre-hepatic is also known as hemolytic causes. So you're having jaundice there simply because what? Red blood cell breakdown was too much. Okay, so things that could cause red blood cell breakdown becoming too much is things like hemolytic disease of newborn, so RH or ABO incompatibility. Okay, G6PD enzyme deficiency, sickle cell disease, hereditary spherocytosis, severe malaria. All of this could make what? Red blood cell breakdown to be too much. Then sometimes you can have membranopathies like hereditary spherocytosis, hereditary elliptocytosis. Okay, then other causes of neonatal jaundice could be due to what? Liver disease. So that's where you're having neonatal hepatitis, viral hepatitis, okay, hepatitis A, hepatitis B, hepatitis C, hepatitis E, then metabolic disorders. Okay, there's sometimes it's drug induced. You know, the liver is the one that detoxifies these drugs. So as you are taking some drugs, basically some of them could be so harmful to the liver. So you say those drugs are hepatotoxic, right? The genetic syndromes like Crigler-Najjar, then Gilbert syndrome. So post-hepatic causes of jaundice, this one you are now saying the issue is happening after the liver. The bilirubin has been conjugated with glucuronic acid, so it's for it to actually get out. Now you are having the issue there. So it could be biliary atresia, it could be choledochal cyst, could be gallstones, could be tumors compressing the biliary tract. Okay, so the next question that was asked for the neonatal jaundice is for you to state out all the investigations, not general investigations, particularly the radiological investigations you do for neonatal jaundice. So basically it's imaging, right? So you do things like abdominal ultrasound, which is the first line, will help you dictate what? Biliary dilations, will help you dictate gallstones, will help you dictate choledochal cyst, will help you dictate hepatomegaly and splenomegaly. Then we have other imagings like what? The hepatobiliary scintigraphy, also known as a HIDA scan. So it's used for a suspected biliary atresia. Okay, so also have things like the magnetic resonance, cholangiopancreatography, that's MRCP, okay, to help to pick up all those choledochal cysts and all those biliary strictures, okay, that are basically causing jaundice. Then CT scan for the abdomen, then also plain x-rays, okay, plain x-rays are actually less commonly used though.